My fellow Americans, tonight I want to speak with you about our nation's unprecedented response to the coronavirus outbreak that started in China and is now spreading throughout the world. Today, the World Health Organization officially announced that this is a global pandemic.
A city deserted, a region under lockdown. Milan, Italy's economic heart, is almost unrecognizable. Hardly anyone in the shopping malls, its famous squares, as the army keeps watch over an almost surreal situation. This is an unprecedented crisis in this country's recent history.
What is happening in my city is worrying me, and it's also saddening because Milan is a lively city, and to see it like this today is almost a defeat for me. I never would have thought this would happen.
Milan's Malpensa airport has now suspended all flights. Its neighbouring airport now restricted to running only domestic flights, but that hasn't stopped people attempting to get away. Fearing further contagion, leaders of Italy's southern regions have warned hundreds of thousands of its citizens who went to work or study in the north of the country not to return home. But groups of people continue to arrive from Milan, arriving with their masks on, but there was no one to test them for COVID-19. The harsh restrictions are designed to slow down the spread of the disease, but there are fears that it may be too little, too late.
Санаторій не предназначений для того, щоб їх тут ізолювати. Ми не хочемо стати зоною ізоляції, зоною відчуження. Нам тут жити. Розумієте це чи ні? Ми просто не хочемо, щоб тут був...
Dr. Anderson took me to another part of the facility to show me where the virus came from. Bats gathered in China for food. A vet here captured one, and in a containment cage, she showed it to me.
And why bats? How confident are you that the coronavirus came from bats?
So I'm probably 90% confident that the new coronavirus came from bats.
The initial contamination, she says, likely happened here at a filthy animal market in Wuhan, China. Someone there, she believes, butchered a bat, came into contact with its blood or urine, and then touched his or her mouth or nose.
Professor Grasselli, what is the situation in Lombardy today?
Well, the situation is critical because we have a huge number of patients currently being treated in the ICU and in our hospitals. I know the situation of the ICUs very well since I am coordinating the network of COVID-19 ICUs. We now have around 600 patients being treated in the ICU in about 55 dedicated ICUs. And we have treated a total of more than 700 patients from the beginning of the epidemics. So if you think that in Lombardy, the total number of ICU beds was about 800, 850, something like that.
A city deserted, a region under lockdown. Milan, Italy's economic heart, is almost unrecognizable. Hardly anyone in the shopping malls, its famous squares, as the army keeps watch over an almost surreal situation.
I want to ask about testing. I'm being asked over and over again why the United States is so far behind other countries and why the American people cannot get tested. Our first case of coronavirus was on January 21st, and the U.S. has tested approximately 4,900 people so far. In contrast, South Korea has already tested almost 200,000 people. They can test 15,000 people a day. South Korea can test more people in one day than we tested over the past 2 months.
Countries around the world are rushing to secure supplies of masks as panic buying and hoarding spreads over fears of the COVID-19 virus. Now, from Australia to Indonesia and even in Africa and Europe, shops are being stripped of masks and other essentials. In Australia, videos like this one have gone viral on social media showing empty supermarket shelves, especially in the toilet paper aisle. The major supermarket chains have now imposed limits. Woolworths is limiting sales to 4 packs per shopper, while Costco has put limits on the purchase of milk, eggs, rice, and disinfectant. The panic buying comes amid concerns by the WHO that masks, goggles, and other protective equipment are running out because of rising demand. Germany and Russia have banned exports of medical protection gear to save their supplies for healthcare officials.
Well, there's a clear sort of balance between people taking proactive, sensible advice and actions to try and get what they need to stay safe. And at the same time, governments don't want people, as you said, to sort of panic buy. it's very common when crises happen that people, instead of just going about their daily life, begin to sort of plan how to keep themselves and their families safe. And I think what we're seeing is a balance between people trying to not get over anxious, but at the same
We're seeing a dramatic fall in demand from passengers and from shippers as a result of the COVID-19. You know, what started in Asia Pacific has now spread globally, and we're seeing a very significant fall. We could see the industry losing $63 billion, roughly 11% of global revenues. And that's really if the outbreak is limited to the major centres in Europe and the Middle East that it is today.
A team of researchers from the University of Queensland are one step closer to developing a vaccine for the coronavirus. Professor Paul Young says they've been able to create their first vaccine candidate in the laboratory.
What we've done is established a subunit vaccine candidate from 3 or 4 weeks ago when we first heard of the sequence, when the sequence was released from China. We spent the next 24 hours examining that sequence and deciding what region of the viral genome we...
A local lab is scrambling to get the coronavirus vaccine out and on the market. It's a race against the clock, but every day Inovio Pharmaceuticals is getting closer to releasing this urgent medicine. News 8's Neda Ehranpour went to the lab to find out what it is they're creating.